The brain is the body organ composed of nerve cells and supportive tissues like glial cells and meninges. There are three major parts. They control your activity like breathing, brain stem, activity like moving muscles to walk, cerebellum, and your senses like sight and our memory, emotions, thinking and personality, cerebrum. Primary brain tumors can be either malignant, contain cancer cells, or benign, do not contain cancer cells. A primary brain tumor is a tumor which begins in the brain tissue. If a cancerous tumor starts elsewhere in the body, it can spread cancer cells, which grow in the brain. These type of tumors are called secondary or metastatic brain tumors. Brain tumors can occur at any age. Researchers and doctors do not know exact cause of brain tumors. Risk factors include exposure to ionizing radiation and family history of brain tumors. The signs/symptoms of brain tumors depend on their size, type, and location. The most common signs/symptoms include headaches, numbness or tingling in the arms or legs, seizures, memory problems, mood and personality changes, balance and walking problems, nausea and vomiting, or changes in speech, vision, or hearing. Doctors group brain tumors are classified by grade 1, grade 2, grade 3, or grade 4, the most severe. The grade is determined by the way the cells look under a microscope. The higher the grade number, the more abnormal the cells appear, and the more aggressively the tumor usually behaves. The most common types of primary brain tumors among adults are astrocytoma, meningioma, a tumor that arises from the membranes surrounding the brain and spinal cord, and oligodendroglioma. The most common type of primary brain tumors in children are medulloblastoma, grade 1 or 2 astrocytoma, or glioma, ependymoma, and brain stem glioma. Studies have found risk factors for brain tumors to include ionizing radiation from high-dose X-rays, for example, radiation therapy where the machine is aimed at the head, and family history. Diagnosis of a brain tumor is done by a neurologic exam by a neurologist or neurosurgeon, CT, computer tomography scan and/or magnetic resonance imaging (MRI), and other tests like an angiogram, spinal tap and biopsy. Your diagnosis helps predict the treatment. Neurologists base the treatment of brain tumors on the type, location, and size of the tumor, your health, and age. Treatment options may include surgery, radiation therapy, or chemotherapy, or a combination of treatments. Supportive care is important before, during and after treatment to minimize symptoms and to improve your quality of life. Some patients can qualify for clinical trials. Contact information is provided at the end of this article. When most normal cells grow old or get damaged, they die, and new cells take their place. Sometimes, this process goes wrong. New cells form when the body doesn't need them, and old or damaged cells don't die as they should. The buildup of extra cells often forms a mass of tissue called a growth or tumor. Primary brain tumors can be benign or malignant. Benign brain tumors do not contain cancer cells. Usually, benign tumors can be removed, and they seldom grow back. Benign brain tumors usually have an obvious border or edge. Cells from benign tumors rarely invade tissues around them. They don't spread to other parts of the body. However, benign tumors can press on sensitive areas of the brain and cause serious health problems. Unlike benign tumors in most other parts of the body, benign brain tumors are sometimes life-threatening. Benign brain tumors may become malignant. Malignant brain tumors, also called brain cancer, contain cancer cells. Malignant brain tumors are generally more serious and often are a threat to life. They are likely to grow rapidly and crowd or invade the nearby healthy brain tissue. Cancer cells may break away from malignant brain tumors and spread to other parts of the brain or to the spinal cord. They rarely spread to other parts of the body. Types of primary brain tumors. Readers comments 3 Share your story. There are many types of primary brain tumors. Primary brain tumors are named according to the type of cells or the part of the brain in which they begin. For example, most primary brain tumors begin in glial cells. This type of tumor is called a glioma. Among adults, the most common types are astrocytoma. The tumor arises from star-shaped glial cells called astrocytes. It can be any grade. In adults, an astrocytoma most often arises in the cerebrum. Grade 1 or 2 astrocytoma, it may be called a low-grade glioma. Grade 3 astrocytoma, it's sometimes called a high-grade or an anaplastic astrocytoma. Grade 4 astrocytoma, it may be called a glioblastoma or malignant astrocytic glioma. Meningioma, the tumor arises in the meninges. It can be grade 1, 2, or 3. It's usually benign, grade 1, and grows slowly. Oligodendroglioma, the tumor arises from cells that make the fatty substance that covers and protects nerves. It usually occurs in the cerebrum. It's most common in middle-aged adults. It can be grade 2 or 3. Among children, the most common types are medulloblastoma, the tumor usually arises in the cerebellum. It's sometimes called a primitive neuroectodermal tumor. It is grade 4. Grade 1 or 2 astrocytoma, in children, this low-grade tumor occurs anywhere in the brain. The most common astrocytoma among children is juvenile pilocytic astrocytoma. It's grade 1 ependymoma, the tumor arises from cells that line the ventricles or the central canal of the spinal cord. It's most commonly found in children and young adults. It can be grade 1, 2, or 3. Brain stem glioma, the tumor occurs in the lowest part of the brain. It can be a low-grade or high-grade tumor. The most common type is diffuse intrinsic pontine glioma. These are the most common symptoms of brain tumors. Headaches, usually worse in the morning, nausea and vomiting, changes in speech, vision, or hearing problems, balancing or walking, changes in mood, personality, or ability to concentrate, problems with memory, muscle jerking or twitching, seizures or convulsions, numbness or tingling in the arms or legs. Most often, these symptoms are not due to a brain tumor. Another health problem could cause them. If you have any of these symptoms, you should tell your doctor so that problems can be diagnosed and treated. Please like and subscribe my channel.